I think this is really the first surgical mission they've had in the hospital here, so I don't think they're really used to having a group as big as ours, and it's part of the experience. I've learned to be flexible about it. It's just what's next and how we're going to adapt to it.
This is Dr. Brad.
They're under a lot of strain as well, meeting a new group. They have no clue how good or bad we are. And always, when they meet us, they're on their guard. The great thing is that if we do it right, we'll be fast friends by midweek. You want to see all of them?
Yes.
Okay, and we'll take the top, older ones for tomorrow.
Okay.
And once we get...
Oo, pero nagkamali sila. Sumaya kayo.
They normally have colostomy right after birth, and they normally close it 2 to 3 years, but for lack of money, they're unable to have closure of colostomy, so they're here for closure.
The reason we're operating on these people in the first place is that they cannot afford the hospital bill. If they earn $200 a year, how can they pay a $300 hospital bill for an operation? They have to buy the antibiotics, the gauze, the tape, the IV, the solution, any drugs, the surgical fee, and that's why they don't get operated on. That's why we're here. Atabe Alfonso, Edward Pahanut,
Wait.
Ralph Cruz. I'll read them again. Is there another hernia here today? Another curveball they threw at us is that this group have brought all the patients in today, and we'll have to bring them all back tomorrow, plus a 2 or 3 hour packing and sorting of our equipment. So it's going to be a busy day tomorrow. We might do that. Open a 10-pack, and the other will be on the ward, on the room on the right in there. Okay. It's looking up.
I'm just going to take those over there. Yeah. Thank you.
Skin so cute. That's for us. You can put this on there.
Ready? 1, 2.
Don't move. Thank you, Kate.
There's something essential about knowing that you did something good for people that day. And, a lot of people, myself included, go into surgery for that feeling. People forget that it's a service job. We're here to serve the patients. This particular group of people is underserved. It's an opportunity for them and for me. They can get taken care of, and I can fulfill my obligation and my desire, which is to provide the service to the people who need it.
The problem is access to refined sugars, Western diets, soda, Coca-Cola signs are everywhere where there aren't even dentists around. So all these kids are drinking their soda pop and not brushing, not flossing. The Philippines has the highest DMFT rates worldwide, which is decayed, missing, or filled teeth, which is a global measurement to compare the rates of cavities around the world.
Everybody has this idea about medical missions and that it's all work and it's just tedious and that only a certain group of people do medical missions. But honestly, I have so much more fun than if I had gone on vacation because I work, we all work, but then we bond and we get close and we go out and have dinner and drinks and laugh. I think I laugh more in 1 week here than I have in Honolulu because you're with your friends.
Everybody's here and we all have this like common goal that like bonds us. Like we just want to be here to help the people. Being in this place and being able to give what I can to help others, like that's the greatest feeling ever. You put so much heart into what you do.
You can see that large mass on the back there. That's the tonsil. Yeah. And that one's the right side is much bigger than the left side.
Last December 8th, the doctor said that it must be removed. We will need 60,000 pesos. We are poor, so we don't get back there again.
God give us strength in my life, and my pain is it's okay. Give thanks with a grateful heart. Give thanks to the Holy One. Give thanks because He's given. And now let the weak says I am strong. Let the poor says I am rich. Because of what the Lord has done for us, give thanks.
Fixing lips and palates, usually you do this operation when they're 3 months. So by the time they're old, they don't know exactly how they look like, and they don't remember how they were when they were 3 months. But when you see these patients now, they're 5 years old or they're 6 years older, and they get ostracized, and they're shy because they don't want to look at you, and they don't talk because most of them have cleft palates. And when you are able to sort of change their whole demeanor and their whole outlook, then obviously that's sort of why I do this. They don't know exactly what the cause is, but some of them think that it's malnutrition and lack of some folate or something like that causes them to have this problem. I think that what I do for these kids in 40-50 minutes makes a difference in their life, makes you feel good, and makes me feel good.
Okay, but she can eat and drink, okay, then she go home today.
I enjoy these working missions better than a vacation. It's an invigorating feeling to have accomplished something. When I talk to people who want to come on missions, I think that's why they like to come. I think we do it because we just like helping others.
Yeah. How does baby look to you now?